I'm Evan Salino. I'm a family physician. I practice here in Portland part of the time, and I do policy work part of the time and try and bridge the gap between policy and practice so that hopefully both worlds work better. Deciding what blood pressure measurement you're shooting for is actually really important. There are various guidelines for blood pressure measurement. They change. The important thing is deciding what you think is appropriate for your population as a practice, and deciding what's normal blood pressure, what is high blood pressure that you're going to flag. There are a variety of reasons why it's important to ensure proper blood pressure management. Of course, you want to have an accurate number to make medical decisions based on for those folks that you do have a diagnosis of high blood pressure for, if they have other conditions that diabetes or other things that you're worried about, and so blood pressure management is really important. You want an accurate number. You also want to find folks that you didn't know had high blood pressure. Undiagnosed hypertension, those adolescents, those adults who come in and you get a number that's surprisingly high, and that's the point of checking it, is to make sure, again, was that an accurate number? Do we need to follow up on that number? Is this something worrisome? So measuring the number, the blood pressure accurately is critical for all of those roles and all those individuals in your population. There are a number of problems that practices can run across. First of all, there's the measurement of the blood pressure itself, which is probably the place that we see most often that there are errors made, again, either in positioning of the patient, how the blood pressure is taken. The cuff size is a very common one, using the wrong cuff size for the wrong person. And so all of those things can certainly affect the blood pressure, either making it high or low. And then again, if you're making decisions based on that number, you really want it accurate and reflective of reality, not reflective of the position the patient was in or the cuff that they were using. Then you're using the wrong equipment and the wrong techniques to get a wrong number. There's a number of reasons why problems or errors occur, mismeasurement of blood pressure occurs in practice. One of the big reasons is practice day is busy, you're trying to get people through, medical assistants may measure blood pressure right when patient first walks in, not measure after they've been sitting for a while. The room may not be set up appropriately to where the patient's arm can be appropriately positioned, or different cuff sizes are available. So again, that can promote people to use what's available in the ways that are available, even though that's not proper technique. The first thing is actually just looking at your rooms and where you put patients and actually thinking about what is proper technique. Can you do that appropriately? That can be done through, just normal trainings that you're having for staff, but as a routine, making sure that works. Going through the process of what you do when you do it for patients is important. In a lot of practices, if they get a high blood pressure with a first reading, they have a protocol to check at the end of the visit after the patient's been sitting for a while, and then they rely on that last blood pressure as the more effective ones rather than the first one that when the patient comes in. It's important to have regular training to make sure primarily that proper technique, that known technique for measuring blood pressure is followed. So again, that's the primary reason for inaccurate blood pressure measurement. There are a variety of things online available that can show proper technique, but actually putting that into practice in the clinic is another thing. Watching the video and then actually doing it, those are different things. There are, again, a variety of educational resources that can be put into clinic rooms, posters that show proper blood pressure measurement. And again, that can help folks in the clinic actually do it appropriately when they're in a busy day. But actually going through the steps, thinking about the position, thinking about the room, thinking about what you do if you get a high number, all of those steps in understanding, are you getting an accurate number and can you make a decision based on that number? All of those things are important to go through and have everybody in the clinic who's doing those things understand how and why those steps are important.